Hi, I'm Dr. Radha Balachandran, Director of Kids Career Center. Today is Cerebral Palsy Day. Every year, October 6th is celebrating World Cerebral Palsy Day to create awareness about this condition. Cerebral palsy is a physical disability which affects body movement, posture, mental reflex, muscle tone, all these motor related difficulties. So cerebral palsy can be a mild to moderate to severe. And they have four types, which is a spastic cerebral palsy, arthroid, ataxic, and mixed cerebral palsy. Spastic cerebral palsy is the most common type of cerebral palsy. Spastic means is a tightness, stiffness. So parents has to know about the cerebral palsy to find out to give early intervention for the kids. So how we can identify the cerebral palsy is the first thing is the developmental milestones. So parents has to track the milestones of the kid. If the child did not achieve the certain milestone, like for example 3 months child has to achieve the head control, 8 months child has to do the crawling, and 1 year child has to reach walking with support, and then 5 years like gross motor functionality. So if the child has any delay in this position, then it may called as a developmental delay. If child has developmental delay, one of the common reason is cerebral palsy. So parents has to be aware about this condition. So in the spastic cerebral palsy, the most commonly affected body parts first will be the monoplegia. Monoplegia means one limb is affected. Mono means one limb is affected. It can be either left hand or right hand, and left leg or right leg. And then diplegic means most commonly lower limbs are affected compared to the upper limbs. And then quadriplegia means 4 limbs may affected. Quadri means 4 limbs are affected. And then hemiplegic means hemi means half, so half of the body, like one side of the body is affected, like left arm and left leg. So like it will be like that. So parents has to know that whether the child has any developmental delay, that they can be having a fix, and then any neurological disorder which affects means we have to give early intervention. So they have to, if there is any developmental delay, any stiffness, mainly any stiffness. Usually many parents, they told me that the child has the stiffness in calf muscle and then hamstring, and then they will be around 3 to 4 years when child started walking, they will be having the scissoring gait. So like that, there will be a lot of difficulties and disorders. So it's not only a physical disability, it's also associated with speech and language and communication, and then writing skill. Even some cerebral palsy may have the learning disability also. So the physiotherapy play a vital and important role to overcome these physical disabilities. So what and all the physiotherapy role? First role is to identify the cerebral palsy. We have to do a proper assessment where the child is, what about the developmental milestones, and then reflexes. We call them as a primitive reflexes. Whether the child has some ATNR reflexes, like that we have to rule out whether any primitive reflexes is persist or not. Then we have to see the muscle tone and then posture. All this we have to assess. After that we have to do lot of physiotherapy technique. Most commonly doing physiotherapy technique is to maintain. The main goal is to maintain and then develop the functional mobility. Like if the child is in the lying position, then we have to do them the rolling over, sit down, crawling, kneeling, half kneeling, and then standing. So we have to do it according to that. So if the child has stiffness, we have to do stretching, passive movement, and then if any developmental delays are there, we have to do lot of neurodevelopmental therapy. Now there are lot of latest therapy techniques are available, such as a primitive reflex integration, and then autotherapy, neurodevelopmental therapy, and then every day the new techniques are coming. So all this technique is to rehabilitate the child and to bring out the maximum potential of the child to achieve. Because here in this 20 years of experience, many cerebral child started walking. They went to the normal school, and then they are doing lot of successful activities in their life. And then many parents, they very much worried about if the child has this cerebral palsy. They need not to worry about that. We have to see where the child is and how we can provide the rehabilitation, and how we can empower the child is a parent's role. So there is a celebrity who is name is Siddharth Jayakumar. He is a cerebral palsy person, but he is a banker. And then APJ Abdul Kalam told about him that his story is a most inspiring story. So the parents, if parents has to know about him, if Siddharth can able to achieve his goals and vision, it can be any cerebral palsy kid can be achieved. So as any public who is watching that, instead of showing sympathy, we have to be support them. We have to be empathetic feeling to the cerebral palsy child and then the parents. And then most of the places, in the public places, they have to give the accessibility. Some cerebral palsy kids, they may be wheelchair bound, and then they may be in the walker. So we should have a ramp in the public places. So like that, public also know about this condition. So if you met any cerebral palsy kid and then parents, instead of telling why your child is behaving like that, and because of your mistake your child is doing like that, it's not anything like that. So as a public, you should support the parents and the child. So finally, every year on World Cerebral Palsy Day, we do lot of awareness program. We identify cerebral palsy kid, and then we provide latest therapy techniques to them. So I hope this video is very useful for you. Thank you so much.